Chapter 12, Segment 4, Vestibulospinal Responses. Jean-Pierre Flourens, Abnormal Head Movements in Pigeons. Vestibular Influences on Posture Control and Balance. Vestibular reflexes keep us from falling over. Vestibulospinal reflexes. The vestibular system measures the movement of the head and sends commands to the postural control system that help reduce the amount of body swaying. Spatial disorientation, an impairment of spatial orientation, an impairment of our sense of linear motion, angular motion, or tilting. Vestibulospinal response. In the vestibular nuclei, the primary afferent neurons synapse on descending interneurons that carry information through the lateral and medial vestibulospinal tracts. Interneuron synapses onto a neuron that controls a leg. The information is transmitted beyond the bottom of the spinal cord. If the information contributes to postural control of the head, it is only transmitted as far as the neck. Spatial orientation cortex. There is not an area of the cortex exclusively dedicated to the vestibular system. No reason for the cortex to process information separately. Information from other sensory systems contribute to spatial orientation. For example, the perception of tilt and self-motion demonstrate a convergence of visual and vestibular information. Vestibular thalamocortical pathways. This is how vestibular information reaches the cortex. Vestibular information reaches the cortex via the thalamus. Temporal parieto-insular cortex is involved in spatial orientation perception. This area of the cortex receives input from both the semicircular canals and the otolith organs. There is a vestibular pathway that leads to the hippocampus through the cortex, and neurons in the hippocampal formation respond to vestibular stimuli. These include a set of neurons called head direction cells because they tend to spike vigorously when the head is tilted in a specific direction. Cortical influences. Areas of the cortex that receive projections from the vestibular system also project back to the vestibular nuclei. Higher cognitive knowledge can affect both perceptions of reflexive responses. Also, the knowledge of the motion capabilities of a specific device can influence motion perceptions. When the vestibular system goes bad, patients develop spatial disorientation. Many experience imbalance. Many cannot see clearly unless they hold their head still. They develop motion sickness. Some develop cognitive problems, and it's hard to diagnose these vestibular disorders. Mal de Department Syndrome, disembarking sickness. Disembark from a boat at sea. After individual leaves the boat, they experience motion sickness and swaying, rocking, or tilting perceptions. They lay in bed and feel the rocking of the waves. Some people do not readapt to being on land and experience these symptoms for months or even years. Meniere syndrome. Individual experiences dizziness, imbalance, and spatial disorientation so severe that they have to lie down. It can happen unexpectedly at any time. It affects 1 in 500 people, and it can happen at any age. It typically occurs in mid-adulthood. Tinnitus, an illusory ringing sound, hearing loss, and feeling of pain or fullness in the ear, can be an inner ear disorder. Treatments include medication to lower pressure in the ear, implanted devices that provide transtympanic micropressure pulses, and sometimes procedures that destroy the vestibular apparatus.